Welcome dear student in one another session. Myself Darshana Shinde. Today we deal with the diuretics. In the diuretic session we see the little focusing on the weak diuretics. Let's start our session. Learning outcomes of our today's session. After watching this video, students should able to understand and recognize what is meant by diuretics, classification of diuretics, then what is meant by weak diuretics. In the weak diuretics we see today osmotic diuretics, acidifying salts, xanthine derivatives and carbonic anhydrase inhibitor. First of all, we see what is meant by diuretics. Diuretics, these are the agent which increases the rate and volume of the urine formation. These agents mainly act on the nephrons and promotes the excretion of the excess of fluids. Diuretics, these are the agents which are responsible for to increase the flow and volume of the urine formation. Rate of urine formation is increased due to the diuretics. These are indicated in the treatment of edema due to the variety of the reasons. Diuretics are the preferred. Then in hypertension, then the drug poisoning to promote its excretion. For the excretion of the poison, we use the diuretic therapy. In hypertension also use the diuretic therapy. Then we see the classification of the diuretics. Diuretics are categorized into the four main categories. First category is the weak diuretics. In the weak diuretics, first it is again divided into four types. The first type is the osmotic diuretics. Osmotic diuretics are again divided into two types, electrolytes and non-electrolytes. Electrolytes example is the sodium and potassium salts, and non-electrolytes example is the mannitol. Then next category of weak diuretic is the acidifying salt. Example of acidifying salt is ammonium chloride. Then the next category of the weak diuretics is the xanthine derivatives. Xanthine derivatives example is the aminophylline. Then the next category of the weak diuretic is carbonic anhydrase inhibitor. Example of it acetazolamide. Then next category, second category of the class of diuretics is the moderately potent diuretics. Example of it benzothiazidine group. Then next category, third category of diuretics, it includes the very potent diuretics. Example of it parenteral organic mercurials. Example of it furosemide, ethacranic acid, etc. Then last category of the class of the diuretic is potassium sparing diuretics. Example of it trimethoprim, then aldosterone antagonist, spironolactone. Amongst that, today we only deals with the weak diuretics and its four subclasses. First of all, we see the water is used as a diuretics. Water, if a water given in excess, it acts as a diuretics. In this case, antidiuretic hormone, that is ADH, remain inhibited and nephron become permeable to the water. In the water diuresis, water is removed from the body greatly in the excess of the solute. Incident major problem, the sodium retention, the water retention being the secondary one. In such cases, water does not act as a good diuretic. If a water retain the sodium and water retention being secondary one, in such cases water is not act as a good diuretic. But if you taken the water in excess amount, it act as a diuretic. Water diuresis is recommended to wash out certain drugs which irritate the urinary tract or are limited solubility in the urine, such as the salicylates, sulfonamides. Then water is also useful in the urinary tract infection. If we Then we see the next class of diuretics, that is the weak diuretics. Weak diuretics, the weak diuretics first class is the osmotic diuretics. Osmotic diuretics is divided into again two parts, electrolyte and non-electrolyte. First of all, we see the electrolytes. Electrolytes have the capacity of the tubule to reabsorb osmotically active substance is limited one. Then, if a plasma, one of such a solute is increased, then its concentration in the glomerular filtration is also increased. That means if electrolytes concentration is increased in the glomerular filtration rate is also increased one. Electrolytes will help in the filtration of the they are help in the diuretic process. Then this increase in the concentration of the solute in the tubular fluid opposes the reabsorption of the water. Okay, by the osmotic activity act as a osmotic diuretics. That means here if electrolytes concentration is increased, then the concentration of solute in the tubular fluid oppose the reabsorption of the water. That means water cannot be reabsorbed. That's why there is a loss of water by the urination process, and this is happen because of the osmotic activity. So electrolytes are known as the osmotic diuretics. This increase in the excretion of such a solute increase the excretion of the water ultimately. Then thus osmotic diuretics should not get metabolized in the body and should not get reabsorbed by the renal tubules. Example of osmotic diuretics is NaCl, that is sodium chloride, potassium salts. They are used as a osmotic diuretics. Then we see the sodium chloride, which is act as electrolytes. Excess of NaCl causes the osmotic diuresis. Intravenous administration of the hypertonic NaCl solution rise the solid concentration of the extracellular fluid and of the glomerular filtration, leading to the diuresis. Sodium salts are however weak in the action as sodium is reabsorbable. Then in case of the edema, where the diuresis are indicate there is already excess of the sodium in the body, sodium salt aggravate the condition. Then NaCO3, sodium bicarbonate, is sometimes used to produce the alkaline urine. Example of its urinary tract infection, and in sulfonamide administration. In such a cases, sodium salt is also used to sodium salt with the combination with the bicarbonate is used to produce the alkaline urine in some urinary tract infections. Then next is a potassium salt, which is used as a osmotic diuretics. These are more effective than the sodium salts. Potassium citrate is commonly used to produce the alkaline urine. Administration of the potassium salt in presence of the renal insufficiency causes the hyperkalemia. Then we next see the next category of weak electrolytes is the non-electrolytes. Example of its mannitol. Mannitol is a sugar, and when a hypertonic solution of mannitol is injected, draws the water from the cell and extracellular space into the vessel. Plasma volume is increased because of the mannitol solution. Plasma, if we inject such a solution, plasma volume is increased, enhancing the renal blood flow, and diuresis occurs. By increasing the osmotic pressure of the glomerular filtrate so that tubular reabsorption water is diminished. It is used as a diuretics to treat the oligosuric condition of the acute renal failure. In such cases, these mannitol-like non-electrolytes are used as a diuretic, osmotic diuretics. It is also used to reduce the intraocular pressure. Then we see the next category of the weak electrolytes is the acidifying salt. Example of its magnesium, ammonium chloride. It is given orally. After reabsorption, it is converted by the liver into urea and ion is formed. This is the ammonium chloride. It is converted into the liver. We get the ammonia, urea. Here H plus ion react with the bicarbonates and other buffers in the extracellular fluid. Then the reduction in the bicarbonate causes the acidosis and fall in the extracellular pH of the tubular cells. Then this believed to cause the diuresis and urine become acidic one. Due to the acidifying salts like ammonium chloride, urine become the acidic one. The excess of chloride ions from the ECF is filtered by the glomerulus and promotes the osmotic diuresis. The diuretic action of the ammonium chloride itself limiting as a kidney compensate for the acidosis by producing the ammonia gas by secreting the more H plus ion for the exchange with the sodium in the tubular fluid. In that acidifying salt, there is if this salt's proportion is increased, then our kidney start the process acidosis, and by that ammonia gas will be the produced, and secretion of more H plus ions, and then more H plus ions are responsible for exchange of the sodium ion in the tubular fluid. In this way they act as a diuresis. The excess of chloride filtered is excreted in the combination as the NH4Cl. Then we see the adverse reaction of it. Because of these salts, nauseous taste, gastric irritation causes, then vomiting. In presence of renal damage, it causes the acidosis. Therapeutic uses. Drug is not used as a diuretic, but it is used as a urinary acidifying agent. Its dose is 8 to 12 gram daily in the divided doses. Then we see the xanthine derivatives. Example of it, theophylline. Theophylline is the best diuretic and it is generally used as the aminophylline. Xanthine probably act as increasing the renal blood by the both cardiac and vascular action, as well as by inhibiting the tubular reabsorption of the sodium. Then it is a weak diuretic, but in order to increase the effectivity, it should be given by the intravenous route, slowly in the dose of 0.25 to 0.5 diluted in a 10 to 20 ml of 5% glucose solution. By this way, this theophylline is used as a diuretic. Then carbonic anhydrase inhibitor. Example of it is acetazolamide. It acts by inhibiting the enzyme carbonic anhydrase. Pharmacological action of it on the kidney and electrolytes. Carbonic anhydrase is present in the renal cortex. Okay. Then carbon dioxide and water, it gives the H2CO3 because of this carbonic anhydrase enzyme. This H2CO3 form dissociate to give the H plus and HCO. This H plus is made available for exchange with the sodium. Thus, enzyme plays an important role in the tubular reabsorption of the sodium. Then acetazolamide inhibit the enzyme by the non-competitive mechanism, so that H plus ions are not available for the exchange of the sodium. Hence, the sodium along with the water is excreted and H plus combines with the HCO provided by the glomerular filter to form the H2CO3, which converted to water and carbon dioxide. Then carbon dioxide form is absorbed one, and then acetazolamide therapy is due to the lack of H plus and Hc ions. Then acetazolamide thus causes the loss of sodium, HCO and potassium ion and result into the decrease in the extracellular fluid and causes the metabolic acidosis. This result in the loss of the diuretic activity. Hence, acetazolamide is a self-limiting one. In this session, we covered what is meant by diuretics, classification of diuretics. In this, we see the weak diuretics, osmotic diuretics, acidifying salts, xanthine derivative, and carbonic acid anhydrase. Thank you very much for attending my session.